Welcome to the Russell Museum on this very crisp fall evening. Thank you to everyone who's here. All right, so I will keep it brief. Just one museum note for you. I'll be passing through a clipboard to the audience. If you are not yet on our mailing list, feel free to sign up so you can keep up with other events and exhibits that you're doing here. I'd like to introduce to you someone who will be introducing tonight's speakers. She's Dr. Ann Klebansky, the Laurie Carroll Guthardt Professor of Medicine, Chief of the Neuroendocrine Unit, and Chief Academic Officer of Partners Healthcare. She is here tonight for a welcome on behalf of this lecture series co-sponsored the Mass General Research Institute. So with that, please welcome Dr. Klebansky.
Thanks very much. It's a great pleasure to be here. Good evening. So before we begin tonight's presentation, I want to take a minute to tell you all about the Mass General Research Institute. So by show of hands, how many of you are aware that Mass General has the largest hospital-based research program in the U.S.? Okay, part of the work is done. Very good. But that's actually one of the reasons why the hospital has launched the Mass General Research Institute. And that is to serve as a front door for promoting our research enterprise. So research at MGH is truly a vast undertaking. There are more than 6,000 researchers, a huge number, working across more than 30 institutes, centers, and departments. And the Institute now will all unite this together in one single institute to really improve human health, which is at the core of the MGH research mission. And as many of you know, despite the truly remarkable scientific advances being made every day here and across the U.S., federal funding has effectively decreased over the past several years and the past decade, and the competition for individual grants has really become more and more intense. More of our funding base has shifted from fundamental discovery, which is really at the core of translational research, to outcomes research. The Research Institute here was founded to promote, support, and guide these very diverse research enterprises. It was also created to help our researchers to continue their vital work in these very challenging times and to help us all advocate for funding all types of research. So research has been part of this hospital's mission since its founding more than 200 years ago. And research is really why the treatment you get today at MGH will only be better tomorrow. So I encourage all of you to learn more about the Research Institute. I think all of you have received these little cards, and I encourage you to take a look at them, read them, see if you have any questions. And when we think about research, clearly, women have been instrumental in the research enterprise here. And actually in the exhibit here on this floor, you can read about just a small sampling of women who have really contributed to healthcare here at MGH. And tonight, we'll have the pleasure of hearing from two very special women who are interested in the intersection of brain science and the law. And I want to introduce both of them. First, Dr. Judith Edersheim, who's an attending psychiatrist, co-founder and co-director of the Center for Law, Brain, and Behavior here at MGH. She has both a law degree and a medical degree from Harvard. She has performed a wide variety of forensic evaluations in both civil and criminal settings, including evaluations of competencies to stand trial, the capacity to make medical decisions, assessment of emotional damages, diminished capacity, and criminal responsibility. Her research interest is in the translation of psychiatric and neurologic behavior in legal settings. Judge Nancy Gertner is a professor of practice at Harvard Law School, a former federal judge, and a faculty member at the Center for Law, Brain, and Behavior. She is a graduate of Barnard College and Yale Law School, and she was appointed to the bench in 1994 by President Clinton. And in 2008, she received the Thurgood Marshall Award from the American Bar Association, Section of Individual Rights and Responsibilities, only the second woman to receive it. Her autobiography, which I would encourage you all to read, In Defense of Women, Memoirs of an Unrepentant Advocate, was released in 2011. She has published articles and chapters on many topics, including sentencing, discrimination, forensic evidence, women's rights, and the jury system. So please join me in welcoming these two remarkable women tonight.
Well, thank you very much for that lovely introduction. I am very proud to be a member of the faculty at Mass General and Harvard Medical School. And as director and co-founder and co-director of the Center for Law, Brain, and Behavior, I have introduced Judge Gertner many times. And I have done it in a long form, listing every award, and that will take you half an hour, listing her accomplishments, her law review, her clerkships, her academic excellence, and none of that tells you the narrative that I'd like to tell, because Judge Gertner is both my friend and a very important dear colleague of mine. And I want to tell you a different narrative. Here it goes. So I want to tell you the narrative of someone who grew up on the Lower East Side of New York. Her parents were, I would say, conservative Jews with an old. We're talking about women in this beautiful display at the museum. So the journey of the Gertner Floor Company took them to Flushing, New York, which is Queens. And these are accolades that not that many people tell. So you're looking at the valedictorian of Flushing High School. And she was a cheerleader. Grudgingly, her father allowed her to venture into the wilds of Manhattan, to cross the East River and go to Barnard College. And much to his dismay, she became a radical. She became a civil rights advocate who was an anti-war activist. Now, to a nice Jewish set of parents in Queens, that wasn't the highest aspiration for their tuition dollars. And the reason I'm telling you this narrative is that somehow someone was born of an incubation of honor and of principle, who steadfastly held to that despite all of its obvious costs. If you're starting out in a legal career, graduating from Yale, having been on the law review, sticking your neck out is not the recipe for great success. Keeping a low profile, being careful, not staying on the record, that is a recipe for success. And in my early years as a lawyer, that was my formula. I wasn't out doing what Nancy was doing with her career. So she attended a forum at Harvard Law, Yale. Yale is her only character. It's her only character called Yale. And she was at Yale, and she was sitting next to Sonia Sotomayor, Justice Sotomayor. And the topic of the lecture was, how can I become a judge? And Justice Sotomayor gave the proper formula. You're very conservative, you're a careful jurist, you are of good temperament, you are not on the record for radical causes. And then the discussion turned to Judge Gertner. And this is what she said, sorry. I paused for effect. Yes, you graduate this fine institution with a stellar record. This is from the judge's own speech. But then, and I paused for effect, you represent the first lesbian, feminist, radical, anti-Vietnam War activist accused of killing a police officer that you can find. That would be your first major case in prime time. You take every abortion case in the Commonwealth of Massachusetts. You speak out on the major hot-button issues of the day in successive rallies on the Boston Common, or on television, or in the editorial pages of the newspapers. You represent defendants of all stripes, from those in political corruption cases to high-profile murder cases, and for the final coup de grace, you married the legal director of the ACLU in Massachusetts. That is not typically the measure of an appointed federal judge, but the wisdom of the day prevailed, and Judge Gertner was appointed. She also, by the way, sued her current employer. She sued Harvard Law School on behalf of a professor who was discriminated against in tenure. And they hired her 25 years later with vast enthusiasm. So my father-in-law used to say, tall trees take the breeze. If you're going to stand for something, you stand for something at your own risk and your own peril, and you do it for the good of other people. And so I would like to introduce you to one of the tallest trees I know.
This is not fair. She hinted at what she was going to say. So now I have to be a little bit extemporaneous. I was going to give the standard introduction of her degrees, which we heard about a little bit. Went to Brown, Harvard Law School, Harvard Medical School. She was a law clerk. She practiced law. Then she became part of the psychiatry service at MGH, and then she founded CLBB. That's the standard approach. But I want to talk a little bit about how I have come to know Dr. Edersheim. So 4 years ago, when I had left the bench, I was teaching at Harvard, and she emailed me that we should meet for lunch. She emailed me I don't know how many times. I probably could have gotten her for stalking. We met for coffee. We have coffee. And she describes CLB. Right, late afternoon on one day, I was half asleep. She was telling me about CLBB. I can't, for the life of me now, recount that conversation or tell you that I understood a word of what she was saying. But all I know is that by the end of that conversation, I had said yes. And then the next thing I know, there was a press release. And there was a press release announcing that not only was I a member of the Harvard faculty, which had been announced some time before, but that I was now a member of the faculty of the Harvard Medical School. At that point, I got a call from the dean's office. Nancy, they said, you really can't be members of two faculties at the same time. I didn't know what she was talking about either. I sent her to Judy and I said, when did I become part of the faculty of the Harvard Medical School? And she sorted it out, as she sorts out everything. That began a collaboration which is on a professional level and on a personal level that has been absolutely invaluable. What Judy brings to this field, and you'll hear it in a few minutes, is the ability to translate. She used her law degree and merged it with her medical degree to translate complex neuroscience concepts to law, and to translate them not just for a professional audience. Others do that in academic journals, etc. She can crystallize this for everyone. And I think that this comes from her, not just her academic prowess, it also comes from her extraordinary powers of empathy. Buried in her resume, in the introduction that was given before, is the notion that she's not only reading and doing and studying and speaking about these issues, but she testifies in court. She is an expert in court. She knows about the application of neuroscience in the courtroom, and again, in the context of real human beings. Ultimately, although I remember nothing from our original conversation, that's what drew me to her. Because ultimately, that's what I cared about. That was why I left the bench. I left the bench because I didn't want to talk law anymore. I didn't want to talk to the public in opinions that no one read and fewer still understood. I wanted to translate my career and the things that I cared about to the wider public. So we shared a professional collaboration, and then the final issue of all this, we discovered that both our parents, from very different sides of the tracks, I might add, Manhattan, Flushing, Queens, not at all the same place, both Jewish, but other than that, the similarity ends. But we were both barred from going trick-or-treating on Halloween. Now, I can't tell you what that did to me for the rest of my life, and we're trying to work that through. It may be that we spend the rest of our life trick-or-treating. And the rest of our lives, going around begging for money. There you go. In various places. But the collaboration has, as I said, extended both professionally and personally, and I have discovered that every time she asks me to do something, I seem to say yes. My husband will say, what are you doing now? And I say, I have no idea, Judy asked me, and that seems to be sufficient for me. So let's get on to some of the work that Judy has done which has been extraordinary. Why don't you start with a description of what CLBB is and why you founded it, co-founded it?
So CLBB was really the brainchild of my collaboration with Dr. Bruce Price, who is a wonderful, stellar behavioral neurologist here and at McLean Hospital. So he is on the faculties of both and chair at McLean of neurology. And we discovered an amazing phenomenon. Because we were both willing to testify in appropriate cases, we were getting calls. And the calls were shocking, and a very large number at an accelerated rate. The calls were requests to take bad science and bring it into the courtroom. The calls were really, I have a defendant. This defendant may or may not have a brain abnormality, and I want you, Dr. Price, or I want you, Dr. Edersheim, to say that his brain made him do it, and to help us exonerate this defendant. In 8 out of 10 cases, it was an unacceptable reach. In 1 out of the 10 cases, it was plausible, and in the last of the 10, 1 out of 10, it was actually an appropriate thing to say. But we both understood that if we didn't say it, someone else would, and we needed to stop the flow of poor science into the courtroom. And that's really how we started. It became something quite different. It became, how can we keep bad science out of the courtroom, but then how can we put good science to work in service of justice? And then we were on a two-person mission.
But bad neuroscience is particularly dangerous because it apparently speaks to the major concepts of the law, truth-telling, eyewitness identification. I mean, the potential for bad neuroscience, particularly, to get into the courtroom is enormous. And
Yes.
you've worked on some of these issues as well.
Yes, both theoretically and practically. The great new tool that opened the floodgates was functional neuroimaging. So many of you have had or heard of CAT scans or MRIs. And those show the picture of the inside and the outside of the brain at a moment in time. It's a fixed image. It shows if there is a tumor, or if there has been a stroke, or there is some kind of abnormality in the brain at a moment in time. But along came the fMRI, the functional MRI, and other forms of functional imaging. And that was a revolution, because in metaphoric terms, you could peer into a working brain, ask it a question, and see what the response was, not in literal terms, but in mathematical terms. And it was quite astounding. Imagine the potential for watching what happens when a brain is thinking. And once word of that penetrated into society as a whole and into the courtroom, then the floodgates began to open. And the question was, what do these abnormalities mean? Are they just normal variants in function? Or are they really something that causes bad behavior or excuses bad behavior?
Give us an example of bad science, and then we'll get on to what good science is. Give us an example of the misuse of this.
There was a famous case in New York. It was called the Weinstein Case, and it's public. I'm not going to reveal anything inappropriate. Herbert Weinstein was an ad executive, and he had a fight with his wife, and he murdered her and threw her off the building of their apartment in New York City.
Defenestration. Although
Yes.
through off the roof.
Yes.
This defenestration is through the window.
Through the windows, yes. There should be one for a balcony. We
Right,
should make
right.
it.
I'll
It
make
was
one
off
up.
one of those balconies in a high-rise
Okay.
in the village. And he threw her off the balcony to make it look like a suicide. All of those facts were known. What wasn't known was that he had a big subarachnoid cyst, a big cyst in his brain. And a parade of luminaries on all sides of this case came to say, on the prosecutor's side, this cyst means nothing, and on the defense side, this cyst made him do it. And it was the first time that that kind of evidence was presented to exonerate someone. Now, later on, the entire scientific community understood, with this new modality and these new enterprises, that that cyst had probably been there since birth. These are congenital findings. If you scanned this room, a certain percentage of people would have that. and that it probably had nothing to do with him killing his wife. He probably killed his wife because he was angry, not because his brain made him do it. And that case catalyzed all kinds of research and was a perfect example of bad science making a bad result.
The judge admitted the evidence as a
Yes.
sentencing matter and reduced his sentence.
I think what the strange outcome in that case was that the judge at an evidentiary hearing before trial said, I'm going to let this in. And then the prosecutor got nervous. He was thinking, well, a picture is worth 1,000 words. The jury is going to see this big thing and think Mr. Weinstein has a bad brain, and they're going to acquit him. So he pleaded out the case to, I think, something like 13 years for the murder of his wife.
So part of the collaboration is that a judge in a situation like that, who's supposed to be the gatekeeper to scientific evidence, Supreme Court has made judges the gatekeeper, is faced with an extraordinarily daunting task, which is to say 2 plausible explanations on both sides about the science. And in a situation like that, the judge said, well, I'm going to err on the side of admitting it, and the subsequent studies suggest he's wrong. And how often does that happen? So now switch a little bit. Now let's talk about good science. What's the appropriate use of the fMRIs?
Well, there are some wonderful examples of when neuroscience has really enhanced justice in the individual case and in the general case. So 10 years after the Weinstein case, a very interesting case came up. I'm from New York, so this is another New York case. I pay attention to all of these jurisdictions, but New York and California always produce very interesting
And always
results.
on the Upper East Side, or are there other parts of the
I'll go to Soho. I will. I'll go to Soho.
Oh, you will, okay.
But this one occurred on the Upper East Side.
Right.
You can make fun of me. So this one happens at an Upper East Side obstetrical practice. There was a doctor called Dr. Z, and Dr. Z was a famous fine obstetrician. So much so that, doctors are always in the know about which doctors to go to. He had as patients his fellow doctors at a hospital. So he was probably about 68 in his prime of obstetrical surgery, and he went into the operating room to deliver his friend, the obstetrician. It was her first child, and he was doing a cesarean section. And he was abrupt with the nurses, and he was a little bit rude, and he put in the incision, and he delivered the baby, and he sewed it up, and then he did something completely bizarre. He carved his initials into her abdomen, right there. So at that point, a nurse turned to him and said, Dr. Z, what are you doing? And Dr. Z said, I did such a beautiful job. Don't you think I should sign it? And of course, everything stops in an operating room and inappropriate behavior happens. The hospital was called, he was removed, other surgeons came in to try to ameliorate this condition. She sued the hospital and Dr. Z, of course, because she was disfigured. And Dr. Z was brought up on charges. That is an assault, that's not a surgery. So there were criminal charges and civil charges. It turned out that Dr. Z, slowly but surely, had developed a type of dementia which shows in personality and comportment, behavior, before it shows in scans or loss of memory or loss of language. And it turns out that that diagnosis, it's called frontotemporal dementia, it used to be called Pick's disease. That diagnosis, once you understand to look for it, it is a real statement of my brain made me do it. It is a before and after. I've seen it in many cases since Dr. Z, where this affliction makes people behave badly when they otherwise wouldn't. And that's the perfect individual case where neuroscience really can make a dent in making a just outcome. Dr. Z wasn't prosecuted. He was evaluated and hospitalized and lived the rest of his life in a supervised setting quietly.
But so there's a difference then between the subarachnoid cyst that is there, an abnormality, but been there for the longest time and affects nothing, may affect some things, but certainly not behavior, and this kind of situation.
Yes.
What about the classic, when I learned about this in the connection with teaching, I was astonished. Right after functional MRIs came into being, you heard about an outfit called, and I'm not joking, no-lie MRI, fMRI. I mean, these are people who purport to have essentially using the fMRI for the purposes of determining whether or not someone is telling the truth. An extraordinary claim, and a claim which could make juries and judges irrelevant, if it were true. True?
Yes, absolutely. So this is you've selected one of the most controversial areas. That's a big surprise. Controversial areas to discuss here, and it's a very fascinating one. So lie detection, of course, is the holy grail. And lie detection has been something that since people were putting grains of rice in other people's mouths in China, or God forbid, dunking
Right,
purported witches in Salem.
if they died, they were lying. If they lived, they were not.
Right.
Not a good test.
Not a good test,
Right.
no. High false positive rate. So the world has been looking for an accurate lie detector for everything from counterterrorism to witness interrogation to crime solving. And the pace of this has accelerated. So the instrument that everyone knows is the polygraph. You hook someone up for a heart rate and breathing rate and skin conductance. And the question the polygraph really answers is, are you anxious about your lie? It doesn't really tell you whether you're lying, it just tells you, are you nervous? So the next generation is a piece of equipment that is EEG based. So you can read someone's brain waves from the outside of their skull using a system of electrical conductance. And that's been around for a long time, since the turn of the century, and it's been used for epilepsy, for thinking about seizures, and many people have seen it. 20 years ago, there was an interesting scientist who devised its use for lie detection. Now that kind of lie detection was called brain fingerprinting, where what you were looking at was whether someone had stored information that they shouldn't have. It wasn't going after the lie itself. It was going after whether those brain waves were registering that you had seen something before or it was novel to you. Finally, fMRI, the fMRI of lying. Looking into someone's brain and trying to see the lie itself. And it worked on this theory. Functional imaging uses metabolic energy, how hard the brain is working. That's the proxy. So either it's oxygen or some form of glucose. You're looking to see how hard the brain is working. That's what an fMRI does, in essence. And so the theory of no-lie MRI, and actually a company in Massachusetts called CFOS, was, look, fMRI will show that when you lie, you're suppressing a piece of information you know and inventing a new one. And that takes more horsepower. That takes more metabolic activity than just knowing something, and it will show on an fMRI. And that's fine, and it actually is a good premise, and people are still working on it. But it got to the courtroom much too quickly. And this is why. Lies are tricky. Not all lies are created equal. So me lying about whether my feet hurt in my new shoes doesn't look the same as me lying about whether I killed somebody. A rehearsed lie doesn't look the same in the MRI as a spontaneous lie. So it turns out that if my mother-in-law asks me, do you love the brisket? And I say back to her, your cooking is fabulous. That leaves the whole layer of this is the worst brisket I have ever tasted, just where it is, and I cover it up with a social nicety. What is that going to look like? What is it going to look like if I lie while I'm taking antipsychotic medication? Or I lie, but I am a terrorist, and I believe in the cause of my lie so completely that I am neither anxious nor working hard? What about someone who is a psychopath? Many psychopaths pass polygraphs because they're not anxious about their lies. What's it going to look like when it is a psychopath and an fMRI? So bringing that to prime time before it was ready was something that CLBB took on, the Center for Law, Brain and Behavior took it on very early. And we had a fascinating symposium open to the public, as all our symposia are, for free. Sometimes you can get free parking. And we had it right here at MGH, and it was called Criminal Minds. And we had another symposium on, is a picture worth 1,000 words in terms of lie detection? and F. Lee Bailey participated, and we had a little kerfluffle in the audience when some corporate sponsors actually came and challenged our view of fMRI. So we hit a nerve, that's fine, and that's what we're here to do if it's the right nerve. So the future of fMRI lie detection awaits. I am not saying that it is impossible to perfect it. I'm saying it's not ready for prime time now.
And then the question is how the importance of these kind of symposia are that they enable a body of research to be done to provide tools for when a judge has to evaluate this. Again, the issue is we bring technical issues to lay courts, lay juries, and to some degree lay judges, professional as lawyers, but not scientists. And without some framework before you get to the celebrated case, it would be tremendously dangerous. The other thing about lies is also that lies are complicated. There are compound lies. Did you like the brisket? Is it yes or no answer? You know, whether or not you fit the spontaneity, the sort of provocation, whether you were provoked to kill your wife, is a much more complicated question. So the lies don't map directly onto the legal concepts. But this is related to another program in which I participated, which was on eyewitness identification, which is also the holy grail. It's the most important kind of evidence that we use in criminal cases. We teach law students that the most significant evidence is what you see with your eyes and hear with your ears. And so when an eyewitness said, Dr. Edersheim just robbed the Bank of America across the street, I saw her, it is the most difficult evidence to deal with. And interestingly enough, it turned out to be problematic in numbers of respects. Can you talk about that?
Yeah. So one of the purposes, one way where I do think that neuroscience, psychiatry, neurology, neuroscience, psychology can help the law is to be myth busters. To say, you know, your concepts about the way the brain works are 100 years old, and we need to help you understand in a humble way, because the law has its own glories, I admire it completely, in a humble way to say we can offer you this new knowledge. And this new knowledge is that the way you're treating memory in the courtroom, we haven't believed that for 75 years. And we're not sure why you're still doing this. So in the courtroom, in much surprise to the great neuroscientists on our faculty, Dan Schachter, who is a great neuroscientist and really the founder of the neuroscience of memory, one of the founding leaders. He is on our faculty and helped us present these ideas carefully. Memory is treated in the courtroom as sacred, as Judge Gertner said. It's a sacred category of evidence. You weren't allowed to bring in an expert to say, you know, it doesn't really work that way, because it was in essence a challenge to the very victim, him or herself.
And the function of the jury as credibility judges, right? If someone is coming in and saying this is a problematic piece of evidence that goes to something as simple as, do you believe this witness? It was seen as usurping the function of the jury.
Yes, so we had to very delicately find a way to instruct people that memory doesn't really work that way. We know it doesn't work that way. It's not a video camera that you actually enshrine in your own mind and then replay. Memory actually has creative functions. It's constructed. It's not recalled in that way. You can't press on for something that happened 5 years ago and expect it to play out as if it's a movie. And it's vulnerable to all kinds of interference, the way constructive processes are. So, for example, there was a great deal of research that showed that the certainty with which you asserted your belief that the guy at the fence table was the guy who robbed you was actually inversely proportionate to the accuracy of your identification. For example, suggestibility was a real problem with memory. Every time someone shows you a picture of this defendant in a lineup or a show up or in a photo array, and every time you see this person in the paper because he's photographed as a suspect and you are the victim of this crime, your memory is influenced by seeing and hearing that this is the suspect. Similarly, cross-racial identifications, all of the research shows, are vulnerable to mistake, because people identify people from other races less accurately than their own, and on and on. And it had to reach a critical period for the judiciary to accept a challenge to the sacrosanct nature of witness testimony. And they did. And they did actually, because Judge Gertner and Dan Schachter's lab and the Center for Law, Brain, and Behavior and its faculty joined an amicus brief to the Massachusetts Supreme Judicial Court with respect to single eyewitness testimony against defendants.
We had this intuition for some time. There was social psychological evidence about this, 20 years ago, about the limitations of eyewitness identification. But it takes a while for that to percolate in a credible way in the legal system. One of the ways that we began to look at was backwards. The numbers of people, eyewitness identification figured prominently in numbers of exonerations. And suddenly the courts could go back and say what had gone wrong, and then looked at this body of science.
Yes. You'd have DNA evidence to say that the perpetrator was not the perpetrator, and you had to put it aside a courtroom process where the victim said, he's the one.
Right.
And how could you reconcile that?
So it wasn't necessarily the intrinsic value of the science that made its way into the courtroom. This is what I'm concerned about, is the difficulty of translating science in the courtroom, good and bad. It took all that time for some of these observations to percolate into court, and what did it was DNA, because we now could see that this person was wrong. Otherwise, you didn't know one way or the other. A witness would recant the testimony, and so you didn't know which was the right version. Well, with DNA, we actually had a sense of which was the correct version. The other area in which CLBB has been working, and we just had a panel last week on this, and which has made major inroads in the courts, is dealing with the juvenile brain. You want to talk a little bit about that and how fabulous we were last week?
Well, I have to say, you were fabulous.
Yes, right.
I did the
I'm
straight
the
man
moderator here,
introduction.
she has to do that.
Yes.
No,
you were.
otherwise I can talk about the rest of the things about your family.
Okay,
Go
that's
on.
So I think really for the field and for those of us, and there have been many who have done wonderful work both theoretically and practically in the field of juvenile justice, perhaps the shining star, the biggest contribution that neuroscience has made to direct legal doctrine has been in the field of juvenile brains. And this is why. I mean, does anyone in the audience have a teenager? Anybody? Okay. So do you need a brain scan for us to tell you that your teenager makes bad decisions? No. No. So no one is going to get the Nobel Prize for discovering that teenagers make really bad decisions. They take risks, they do strange things, they think tomorrow is 5 years away. Why are you starting your paper at midnight? Because it's only due tomorrow. Really? So it didn't take neuroscience to show that teenagers make bad decisions. It took neuroscience to prove that there was a biological reason that this was so. That they had different brains, that their brains were not fully mature in very important areas, and that those areas have to do with all the things that make them make bad decisions. Future orientation, assuming unreasonable risks, thinking that the rules don't apply to them. All of those can be directly traced to the way their brains are working at the time these things are occurring. That body of evidence has made a tremendous contribution to how we think about adolescence in the justice system. So since about 2005, there have been 3 beautiful Supreme Court cases which have directly referenced neuroscience of adolescent brains in understanding that we should treat juveniles differently because of 2 reasons. 1, they think differently in a way that is not their fault. And 2, we can fix them. They can grow up. They can improve. They can change. We aren't identifying young chronic criminals. We're identifying people for whom we can do better. And the neuroscience convinced the Supreme Court of that in 3 cases, Roper v. Simmons, Graham, and Miller. And the first ruling was that the death penalty is inappropriate for juveniles. Then that the life without the possibility of parole was inappropriate for non-homicide crimes. And finally, that life without the possibility of parole couldn't be automatically meted out to juveniles without an individuated hearing about their risk, their motive, their potential, and their development. And that really was a revolution, and where good neuroscience made good law. And it's just an amazing thing to see.
And again, there was always a normative view in other countries, an ideological position that it was wrong to execute juveniles. Other countries didn't use life without parole in the way that we did, but normative arguments, and arguments of certainly about international human rights, fell on deaf ears. The court needed to see concrete evidence of difference between the juvenile brain and the adult brain. And that suddenly made it able to draw the line that it was unable to do ideologically and normatively up until that point. So it was a great example of that. Tell us a little bit about the program, we'll be about 2 more minutes. Tell us a little bit about the kinds of programs that CLBB does. So CLBB is essentially a platform for writing and programs and amicus briefs and lunches and dinners and fabulous things. You want to go on a little bit about that now that we're running out of time?
And I really do want to thank you for coming out this evening, for participating, for listening, and would welcome your participation in this community. We have a beautiful website, which is a recognized leader in the scholarship in this area, to gather all of the information that's happening and present it to you in a way that you have time to digest, that you can participate in. We have guest blogs from our faculty. We will tell you what we're doing about these things, and in each of our programs, memory, criminal responsibility, juvenile justice, we have a program on elder fraud. So one very similar to projects on juvenile justice. We now understand that a great deal of our population will be cognitively impaired because of the age of the population and the prevalence of mild cognitive impairments and dementias. And we need to protect our old folks and our young folks. My father used to say that a society should be judged by how it takes care of its seniors and its toddlers. And our society isn't doing as good a job as it needs to. One of the ways that neuroscience can be in service of this is actually to enlighten people about neuroscientific advances that can be useful in elder fraud, and that's our elder fraud project, and how we need to incubate toddlers with their vulnerable brain development in order to not sentence them to a trajectory of impaired brain development. And so those are our current projects. We have an upcoming, we were talking about Lawrence Steinberg, who is one of the greatest neuroscientists in the field of juvenile justice. And he's coming to speak for us at an open forum on November 13th at the law school. We have all of these. Please go to our website and sign up for free. You have to register. We will be writing amicus briefs to the Supreme Court and other courts in the Commonwealth. Judge Gertner is director of our Harvard Law School initiative, and she teaches our neuroscience and law seminar so that we can train young lawyers of the future to understand these concepts and apply them in a responsible way. No more, my brain made me do it in a knee-jerk reaction, but a real understanding of what neuroscience can do for justice. So we'd love to have you on our team.